Good afternoon. My name is Stephanie Curry, and I'm going to speak to you today regarding the literary review I performed on catheters and urinary tract infections. We're going to review urinary retention, indwelling catheterization versus intermittent urinary catheterization, and we're going to determine whether either method for relieving urinary retention results in fewer urinary tract infections. Urinary retention is the inability to void or empty the bladder voluntarily. The condition can be acute or chronic. In acute urinary retention, it's usually a sudden onset and it's usually accompanied by bloating, urinary urgency, and lower abdominal and suprapubic pain. Acute onset typically requires medical intervention. That medical intervention is the inserting of a catheter to drain the bladder of the urine. In chronic urinary retention, there aren't any of the symptoms that are associated with the acute phase. The treatment for either acute or chronic is an indwelling catheter or intermittent catheterization to drain the urine from the bladder. In a dwelling catheter, that's the catheter that is inserted and it stays. So it has a tube going from the outside of your body into the inside of your body, and it drains in through a tube into a drainage bag that collects the urine. In an intermittent catheterization, that's the in and out method for that. The intermittent catheterization is the most preferred treatment for bladder emptying in patients with neurogenic bladders because it has fewer complications. And we're going to, as we get into the study, we will determine if the method for relieving urinary retention results in fewer urinary tract infections. Hypo. The population, who's the target group for the study, the adult with urinary retention. The intervention, what treatment is being considered, is indwelling urinary catheters. The comparison is the intermittent catheterization to the indwelling, and the outcome is what are the expectations of the interventions if there's going to be fewer urinary tract infections from intermittent catheterization. Urinary system. The urinary system, it's composed of two kidneys, two ureters, the bladder, the urinary sphincter, and the urethra. So the upper urinary tract infection consists of the two kidneys and the upper parts of the ureters, so the upper part of these. And the lower tract contains the distal portion of the ureters, the bladder, and the urethra. The kidneys function as filters removing waste from the blood while creating urine during the process. The ureters drain the urine from the kidneys into the bladder where it's stored. The urine then flows involuntarily from the bladder to the urethra where it is voluntarily released. The normal process of urination requires normal bladder function and is controlled by the central nervous system. Any disruption of that process results in what is called a neurogenic bladder, which is a problem that people would have with maintaining continency or the problem with voiding or eliminating the urine. The ultimate goal for treating those with neurogenic bladder is to protect the urinary tract from damage and to maintain urinary continency. Common causes of urinary retention are obstructions, which is to be narrowing of the urethra due to strictures, constipation, cancer of the prostate or bladder, trauma, neurological reasons. They involve the central nervous system, so they can be affected because of strokes, multiple sclerosis, spinal cord injuries. The search history that I used Google and Google Scholar. You can see the databases there for you, which I used. The research, there were some systematic and some literary reviews. The trials, randomized clinical trials, and meta-analysis. And then there were some samples that ranged from very small double digits into the thousands. The reason for the study: adults with urinary retention require placement of an indwelling catheter or clean intermittent catheterization. Urinary tract infection is the most common type of healthcare acquired infections associated with urinary catheters. So folks that have to either have a Foley catheter inserted all the time, or they use the intermittent method of draining their bladder, they're going to be predisposed to urinary tract infections. Again, clean intermittent self-catheterization is the preferred treatment for those who are willing and capable of doing so for chronic urinary retention. Patient education on how to safely perform the procedure, the catheterization schedule, urology follow-up appointments, ordering and maintaining supplies, or everything that should be reviewed if someone is going to have self-intermittent catheterization. If they're going to have the indwelling, it's usually replaced every 4 weeks. For those folks that are at home, they usually go back to the urologist's office and they change out the catheter. Those people that are in like long-term care facilities, it's usually done every 4 weeks by the nurses. The main responsible infection is what they're called catheter-associated urinary tract infections. They account for almost half of hospital-acquired infections, and approximately 100,000 people can die from this type of infection each year. The theme summary is the systematic and literature reviews that primarily focus on clinical outcomes of patients who had a diagnosis of neurogenic bladder and their risk for developing urinary tract infection. There were various studies that were done regarding the coding and the type of the catheter, and then the studies did not yield definitive findings, with various reasons varying from insufficient information available to provide a finding that could be defended. So basically here, we're talking about the different type of catheters. They're talking about if they're silicone versus latex, if they have a different type of coating, like a hydrophilic catheter has a special kind of coating, if you should use extra lubricant to make the catheter insertion easier. These are all things that were involved in the systematic and literature reviews. And our conclusion is that we had numerous studies performed. There wasn't, in the end, definite sound proof that there's a difference in the risk for catheter-associated urinary tract infections depending on the type of catheter used. Both indwelling and intermittent, the folks that had to use those methods for maintaining their continency because of neurogenic bladder, they all were predisposed for urinary tract infections. So I would like to leave you today and just saying that the Bible does not encourage blind trust, but does acknowledge that some things, such as God's love and grace, are not visible, but they are there for those that have faith. Hebrews 11, chapter 1st through the 3rd verses state, "Now faith is confidence in what we hope for and assurance about what we do not see. This is what the ancients were commended for. By faith we understand that the universe was formed at God's command, so that what is seen was not made out of what's visible." I'd like to thank you, ladies and gentlemen, for your time. Thank you.